Good morning, and thank you very much for inviting the Commission that has been very well challenged to explain you why we are taking a new initiative on active and healthy aging. Actually, when we started to think about how to promote, how to really make that the innovation in Europe takes up, the Commission has analyzed very carefully the Lisbon strategy and why we failed on Lisbon strategy. One of the reasons that the results of this analysis was that demand and supply on innovation are disconnected. And then we start to think about new ways of doing things, new ways of pushing and developing innovation in Europe. One of the new instruments is to work through partnerships. Partnerships that should address the societal challenges. And as you all know, aging is one of the biggest societal challenges we have for the next 10, 20 years. I just explained you why the Commission is starting to take some initiatives, not alone, but with all of you, with all the stakeholders around the issue of aging, why the Commission has dedicated this year to active year for aging population, and what are the initiatives we are launching. The first thing I want not to spend too long, but yes, I wanted to share with you how the pyramid of the population structure is changing from the 50s until the other 50s. So you will see that the pyramid is completely changing. And when we are arriving to 2050, you will see even population over 100. They are important in terms of statistics. You see also how the pyramid is changing, and this is having important implication, will have important implication not only in our population, but in our society as a whole. Aging is classically presented as a problem for the society. The view of the Commission is aging should be presented as an opportunity. This is why we talk about the shifting paradigm of aging. For the moment, the scenarios, the forecasts are that these societal challenges are creating burdens, will create burden. Basically, we are based in a passive care system, just curing diseases. Of course, if we know the dependency ratio of the current situation, the current population, is that 4 people are working and 1 person is dependent. In the 2025, the expectations, the forecasts are that for 2 people working, 1 is dependent. This also with the forecast that by 2025, population over 80s will be doubled in respect of the current situation. Of course, that means that the cost of care in general is going to extremely increase. And of course, we will have a problem of human resources in the health sector. We have shrinking workforce, and we will lack around 20 million carers already in 2020. That's the perspectives, and what the Commission is proposing is to go into another scenario that will be empower more the people, the aged people, getting them more active and independent, exploring new care models, in particular integrating care and health models, in terms of also using better the resources we have to gain largely efficiency. All of this can, of course, bring us new opportunities for companies, creating opportunities, growing the markets, not only at European level, but also globally. We are starting to see already now the development of what we call the silver market, not only for certain type of industry, but in general for overall consumers that can create new demand in this market. So the Commission has proposed a new way of working. It's not just about changing the legislation that things are going to get better. It's about having an holistic change, an holistic vision on what to do. Our proposal was to launch an European Innovation Partnership excuse me, on active and healthy aging. This partnership will be composed, it is already composed, by the main stakeholders around this topic. I'm very pleased to see in the room very representative members of the steering group we created. So maybe they can hopefully explain even better than me what is this partnership for them. But the common consensus was to have a common headline target. And this headline target is to increase by 2 the healthy life years by 2020 as an average in Europe. But this is a very general target. And to be more concrete, the objective is to improve the health and the quality life of all the citizens, including older people population, to support the long-term sustainability and efficiency of the European health systems and social systems, and of course to foster the growth and the expansion of our industry in Europe to be competitive, to act also globally. But we are in a moment, in a period, you know better than me, sorry, the Commission will not dedicate more resources, but Member States neither. So we are in a moment where we have to do is to use better what we have. So this is what we are using as a first criteria, as a first way of action in this European partnership. What we want is to identify what is working, what we can scale up, and what we can use as a multiplying factor in other areas, in other regions in Europe. Of course, we need to join up resources. We need to use the expertise in a better way. We need also to identify what are the gaps in terms particularly of innovation, why those existing technologies, existing capacity of innovation are not fully developed. What are the mechanisms that can be used to speed up what is already in the market, how to foster this innovation process. And finally, of course, regulation is important, very important. Is what we call framework conditions. We need to improve the framework conditions. We need, of course, to revise legislation, not only legislation on pharma industry. We need to revise how procurement is working in Europe. We need to revise how data protection is working. We need to see what are the problems on the standardization, why a company developing a product in a region cannot export to another region, a neighbor region, because just the standards are different. So, of course, there are framework conditions that is important, and we need to modify. In doing that, it's not just a mechanism top-down that is going to change things. For us, the idea on the European partnership is to develop collaborative innovation. Of course, we need to be together with the interested stakeholders, private and public. We need to identify what is the value of the cycle of innovation and how to push it. We need to cooperate and have a common vision, and we need to find not only innovation solutions or innovative solutions in terms of technology. Innovation should be also a broader process. We need to see how we need to innovate in the organizational business, how we need to innovate in the way of our health systems are conceived to be more efficient. So at the end, what we need to put is the innovation to the demand, to the needs of the citizens. As I say, what we don't want here is to organize a new programming, a new financial instrument, a new program like FP7 or like the Joint Programming Initiative. What we want is to use what we have better. You can see in this slide the different instruments, financial instruments, are using in Europe for active and healthy aging, or could be used. You see from the FP7 until the structural funds, Jasper, Jeremy, Public Health Program, Ambient Living Association, GAP&D, all the Joint Programming Initiative. All those instruments are, for the moment, disconnected. What we want to do in this partnership is to optimize the resources we already have. We want to align priorities. Active and healthy aging should be a priority in all of them because it's the next challenge of our society. We need to use them more and better, and we need to coordinate them because for the moment there are a lot of duplication, a lot of overlapping, and they are one replacing others. So for doing that, we convoke a steering group. This steering group, as I say, composed by several of the presents in the room today. They decided at a very high level, they decided together that we need to have a new vision, a holistic vision. This vision is that the aging should be an opportunity. Aging should be also focused on the political agendas, and we need, of course, to put innovation to the service of all the people. This vision, they say, okay, it's good to have a vision, but to make a difference, and we want to speed up, that means that we need to go quite fast. If you want to change things, if you want to go and focus on actions, you need to focus on three main pillars. The first main pillar is about prevention. Prevention in the sense of screening and early diagnose situations that we can modify in a very short term. The second pillar is to focus not only on care and cure, but also in care at the same time, is what they say, care and cure. And the third big pillar is to focus on getting the people active and independent before they are disabled, before they are getting in disease situation. So for these three areas, they identified a possible list of actions, and they say, this is not going to work if we don't have a common roof. And this common roof is what we call the framework conditions. So if we don't have a regulatory body, a regulatory system that allow us to do that, same for standards, same for funding, and of course, we need data, we need evidence, we need to share what is working, we need to share methodologies, we need to have common ways of sharing. Doing that, they said, okay, if we want to really change things in the next 2 to 5 years, you need to focus on very concrete actions. And these very concrete actions are 6 of them. The first, they propose to launch a big program on adherence to treatment, prescription and adherence to treatment at regional level, focusing on real patients, focusing in regions, organized at region level with the support of different stakeholders, including regional, local, and national authorities. For that, they want, we want to provoke an action using, of course, advanced clinical ICT-enabled tools, training or creating capacity building for the health workforce, creating information and awareness and healthy therapy campaigns when necessary, and of course the real application of clinical protocols. The idea, the aim, is to focus and to identify the non-adherent patients and counseling them, advising them on the use of medication. It has been said that multimorbidity is a real problem for all the population. It is indeed. But of course, the polypharmacy associated to the chronic condition is a problem. This action wants to tackle that. The second action is to launch an important falls prevention initiative. This falls prevention initiative should be also at regional level, and the target is that we launch this initiative in more than 10 EU countries. How? We have, for the moment, enough technology, enough capacity to identify, to screen the risk factors of falls. Of course, we already have programs, financial programs, supporting these actions. What we want is to use and to mobilize what is already there, what can be used, can be multiplied for implementation of guidelines and for having real actions at local level. Of course, the aim is to reduce the falls of all the people that you know is a very important problem in all the population. Also, we identify functionality, the decline of functionality and frailty as a big problem, and there is an action focus on that. The idea is to launch validated programs with preventing tools and measurements of the population at risk. For instance, screening on malnutrition is one of the ideas that they are on the table. For that, of course, the how to do it is to launch nutrition screening programs at hospitals, even at home, to prepare guidelines for multidimensional intervention, and of course to improve the standards and the interoperability of the diagnostic tools that they are for the moment. The third action is to focus on integrated care for chronic diseases. We tackle here particularly multi-chronic condition, multimorbidity, and the target is to launch 2 big programs, one in more than 50 regions that's affecting more than the 10% of the target population. And of course, the second is to replicate what is already there. They are very good experience across the EU. What we want is to use this experience and being able to replicate them in other areas in Europe where they are not so lucky. We want to use these models and to replicate it at least in 20 regions in 50 member states. How? The idea here is to use innovative models, innovative ways of integrated social care and health systems for multimorbid patients. Of course, using technology, of course, using new ways of organization of the systems. Here we have several interested regions that propose, of course, having different indicators. We can precise more the technical details during the discussion if you want. There is also an interesting action which is about creating what we call age-friendly cities. Age-friendly cities that are a model that has been developed with a methodology of WHO, has been used for the moment in several parts of the world, not only in the United States, but also in Latin America or in some parts of Asia. The idea is to set a list of requirements to get a label of age-friendly city. And this is just actions around not only health, but also about environment, transporting, building, use of the building, care models, etc. The idea here is to create networks, to create platforms, and to create really a list of guidelines for innovation, how they can support age-friendly environment in general. There is a 6th action, which is about standardization and creating guidelines and protocols for using standardization in the different part of the different industry across Europe. And all these 6 actions are already there. But how is it going to work? Who is going to do this action? It's not the Commission doing this action. The Commission has put forward what we call an invitation for commitment. Here, the action should come from the bottom up. The action should come at local level. The action should be done by the different stakeholders. They are organizing platforms, organizing projects, organizing different initiatives. What we have done is to launch this invitation for commitment last end of February. It's open until the 31st of May. The idea is to group, to cluster what's going on in different action groups. That action group will be one of the 6 actions that I detail. And the idea is that all together they can create really a critical mass to deliver against certain expected outcomes. We also want to mobilize the public authorities because member states and regional authorities are key determinants in this process. To mobilize the region, we already created a call for interest or expression of interest on what we call the reference sites. These reference sites are regions or geographical places in Europe where already similar things on what are in this partnership are going on. The idea is to give this label to these regions And these regions should be a kind of mobilizing factor for other regions in Europe. We already got several expressions of interest. Important regions in Europe would like to become reference sites for active and healthy aging. And with this open for invitation, we expect to receive even more. And we also create a new thing that we call it the marketplace. This is a virtual platform where everybody, all type of actors, can go and exchange ideas, find actors, find ideas for getting funding, or just developing, exchanging information and sharing best practices models. This marketplace is going to be open on the 3rd of April, and the idea is that it's going to be a kind of greenhouse to promote actions across the different regions in Europe to be part of the partnership. We want also to have a very light governance, and this governance is just based on what the different stakeholders are doing in the action groups, and once per year they will be together in a conference of partners, and it will be also a steering group that is a little bit coordinating the result of these actions, because we have an important commitment with the European Council. We have to deliver results by the next year. End of this year, the Council asked us, in particular the head of state, asked the Commission, go ahead with your partnership, mobilize your actors, but please bring us some results to show that working in a different way is giving more fast results. And this is why we are also here calling you to go for action, helping us to develop this new way of working. Thank you very much.